Erlanger is leading the charge in cancer research with a new scanner that pinpoints every single smallest detail. Here's more.
So PET scan, it stands for positron emission tomography, which is a big name, but it is practically a scan to look at your inside of your body, to look at different metabolic processes inside the body. With the PET CT imaging, it's molecular imaging, and we are finding where the tumors are, how they are responding, and we've got PET CT scanners are very common these days. We have got here at Erlanger one of the best state-of-the-art PET CT scanner. It's called Siemens MCT Biograph Flow. Flow is kind of symbolic, like, because we are using flow motion technology. So the older conventional PET CT scanners are using step and go, like bed positions for image acquisition. It's like we inject a radio tracer and the PET CT scanner takes images of how the metabolic demands of the body, like anything which is more actively growing will utilize more of the radio tracer. The radio tracer that we are using is radioactive glucose. So cells which are active take up more glucose. And that's the idea behind the PET CT scan, especially when we are imaging cancer patients. And this is how we see the tumors, where the tumors are. And the idea is to stage patients who are, like, let's say if a patient has been diagnosed with lung cancer on a CT scan. Then the idea of doing PET CT scan is to see how aggressive the tumor is, and then to see if there is disease elsewhere besides in the lungs. Once the patient comes in for the PET CT, he checks in with the schedulers, and then they walk into the nuclear medicine division, where one of our nurses take them and do a pertinent history and take their blood glucose and check their serum creatinine. And then we inject the patient with a radioactive material, which is a radioactive glucose, F18 fluorodeoxyglucose. And once that's been injected, the patients relax in dimly lit rooms for like at least 60 minutes. That's the time for the uptake of the radioactive material inside the body. After that, the patients are taken to this imaging room where they lie on this PET CT scanner bed, and then so it's a PET CT scanner, means there is a CT component and there is a PET component with it. First we acquire the CT component, like we acquire the CT images, which takes few minutes to do, and then comes the PET part, which takes like 15 to 18 minutes. This is how it's done. And afterwards, after the images are done and the radiologist is happy with the images, then the patient leaves. That's it. Based on the legacy of our Erlanger that we have, like, we try to provide best quality care to our patients, and best quality care to our patient means best clinical management and taking care of them. I think that's the best machine that we have, and not very many centers out there have it. And within the Chattanooga, I don't think so anyone has this newer technology.
Interesting stuff as always there at Erlanger. Folks, for more information, you can always contact them at 778-LINK or go to the website, which is erlanger.org. Joining us right